everyone. Welcome to your lecture on activity and mobility. These are the learning objectives that we will be covering. Let's talk about benefits of physical activity. It obviously elevates mood and attitude, keeps us physically fit, right? It helps individuals quit smoking and stay tobacco free. It boosts energy. It helps in the management of stress. It promotes a better quality of sleep and improves self-image and self-confidence. Now, as nurses, body mechanics and alignment are extremely important, along with the benefits of exercise and mobility and activity. It's also important to know body mechanics because as we're moving patients, as we're transferring patients, repositioning them, we need to make sure that we're not destroying our body in the process. So basically, movement is a complex process. It requires coordination between the musculoskeletal and the nervous system. Body mechanics is coordinated efforts of both these subsystems. Body alignment, also known as posture, is the positioning of the joints, tendons, ligaments, muscles while standing, sitting, and lying. Now, these are important terms for us to remember. As we move on in these lectures, we'll refer to these words, and it's important to know the meaning of those. So, when you have correct body alignment, all right, it's like your posture. If your posture is correct, it reduces strain on your musculoskeletal structures, like your joints, your bones, and stuff. It aids adequate muscle tone. It promotes comfort and contributes to balance, and we actually conserve energy, right? Body alignment means that the person's center of gravity is stable, right? And we're going to talk a little bit about center of gravity the next few slides. Balance is required for static positions, sitting and movement and walking. Balance is compromised with age. It's an age-related change. Disease processes, any injury to your musculoskeletal or your nervous system. When you have pain, it's also affected. Life changes and medications. Impaired balance threatens mobility and physical safety, and this is what causes falls and activity restrictions in our patients. Now let's talk about gravity. Basically, as you notice here, that's your center of gravity right here, right? You want your center of gravity at the base of the support right here, right? And you don't want it out here. So if you notice, the person is leaning, right? So that creates hazards, like the person can fall, they can go off balance. The alignment is not correct over here. So weight is the force exerted on the body by gravity, always directed downwards, causing an unbalanced object to fall. Patients fall when their center of gravity becomes unbalanced, like over here, right? Center of gravity is usually 55 to 57% of the standing height at midline, right here, right? Friction occurs in the opposite direction to the movement. So if you're pushing this way and movement is this way, the force of friction is that way. That's where friction is going, right? So the greater the surface area, the greater the friction. So basically, the greater this area is, the greater the friction is. Larger objects produce greater resistance to movement. So as you're pushing this, because it's a larger object, it's creating more resistance. So now, what regulates the movement? Regulates movement in the skeletal system. We have bones, joints, ligaments, tendons, and cartilage. Now, I'm not going to go over the details of these because this is your basic anatomy review, so please read over this. It's important for you to know this to understand musculoskeletal system disorders. Skeletal muscle. Again, this is review of anatomy, but basically skeletal muscles have the ability to be stimulated, excited, and thus can respond to regulatory mechanisms such as your nerve signals from your central nervous system. ATP is the energy source for muscular contraction and requires glucose and oxygen, right? Atrophy is when you have muscle atrophy is when you're shrinking of muscles due to prolonged inactivity. That's why it's extremely important for patients who are bedridden to do range of motion exercises to make sure that the muscles stay toned, right? Exercise increases muscle size and can lead to hypertrophy, like overgrowth of muscles, right? Muscle function, it facilitates movement, stretch reflex. Muscles for movement are primer, antagonists, synergists, and fixators, right? Muscle tone or tonus is the normal balanced muscle tension. Now, when we talk about activities of daily living, these require muscle action, right? Help maintain muscle tone. For example, in order to do the activities of daily living, the patient has to have good muscle tone, right? When a patient is immobile or on prolonged bed rest, activity level, activity tolerance, and muscle tone, all of it decreases. So over here is a chart of basic, the functional classifications of muscle action. These are some different muscles. Again, it's a review of your anatomy. Please, review these. This is your synergist muscle. This is your synergist again. This is your biceps, please review that. So what are some muscle abnormalities we see? Basically, normal muscle tone involves a slight resistance to passive joint movement. Normally, as a joint moves through its range of motion, muscle resistance is smooth, constant, and even. That's how we know it's normal. So hypotonia happens when you have decreased muscle tone with little or no resistance during passive muscle movement, right? And common in patients with cerebral damage. Patients tire easily and they have difficulty rising from sitting position, sitting down without support, and walking up and down stairs. And we see this a lot in patients who are, older in age, or patients who have been immobile for a long time. So there are two different types of contractions, and these are very important for you to remember. You have isotonic contractions, right? They're concentric tension. Increased muscle contraction causes muscle shortening, and that results in movement. These are isotonic. And then eccentric tension causes lengthening of the muscle to control the speed and direction of the movement by the movement of the antagonist muscles, right? Whereas isometric contraction is static contraction, right? The movement isn't there. So increase in muscle tension or muscle work, but no muscle shortening or active movement occurs. So this is static. It's isometric contraction. So what happens is that energy expenditure increases, increased respiratory rate, and the work of the heart. So that's the reason why it's contraindicated in patients who've had a history of an MI or who have COPD. So it's extremely important for you to remember these two types of contractions. So you have the concentric, eccentric, which are isotonic contractions, and this is, involves muscle movement. And then you have the static contraction where there's no movement, but there's increase in muscle tension or muscle work. Okay, the nervous system. This is also a basic review of your musculoskeletal system, your nervous system, Please review this. It's extremely important. So over here, disorders of that alter neurotransmitter productions. For example, you have Parkinson's disease, there could be a disorder of the transfer of impulses. You see that in people with myasthenia gravis. Or the activation of muscle activity. You see this in patients with multiple sclerosis. All of these impair the movement, right? And these neurotransmitters, which chemicals, acetylcholine, for example, these transfer electrical impulses from the nerves in your myoneural junction to stimulate muscle, causing movement. So these nerve impulses, actually, these chemicals, these neurotransmitters, cause that stimulation that makes the muscles move. So different disorders can be for different reasons, as we just mentioned. Then you have proprioception, muscle sense that makes us aware of the position of the body and its parts, including body movement, orientation in space, and muscle stretch. And you see sometimes people lose their sense of proprioception, especially with age. Balance and alignment occurs when a person is properly aligned with a relatively low center of gravity. Remember we said about 55%, right? Gravity balance over a wide, stable base of support. So your legs are wide and you have that balance at about 55%, the center of gravity when standing. And a vertical line falls from the center of the gravity to the base of support. If you notice right here, that's your base of support. It's good and wide. Your center of gravity is right there, about 55%. And, you can draw a vertical line straight from the top to the bottom. So this shows good balance and alignment, right? And if you notice when you're bending, you bend on the knees. Your base stays wide and your center of gravity is still straight, right? We don't want to bend by the back and, bend using our back. We want to bend using our knees. And it's extremely important as nurses for us to practice this, because otherwise your back will kill you, right? So the nervous system basically controls balance, specifically through the inner ear and the cerebellum and vision. To achieve balance, as you can see here, widen the base, bring the center of gravity close to the base of support, bend the knees, flex the hips until you're squatting, and maintain proper back alignment. Postural abnormalities, there are different types. Please review these. These are the different, postural abnormalities you'll see in, people sometimes. You have scoliosis, kyphosis, decorticate, decerebrate, dystonia, basal ganglion posture. Please read over those. These are important for you to know as well. Activity and exercise. Let's talk about activity and exercise. Physical activity is any movement produced by your skeletal muscles that results in energy expenditure. For example, sports, conditioning, household activities, right? Active lifestyle is important for maintaining and promoting health and our psychological well-being. We talked about the benefits of exercise earlier, right? The best form of physical activity is a combination of isotonic exercises and isometric exercises. Remember, we talked about isotonic and isometric, and that's why it's extremely important for you to remember these terms, because when we refer to them, you will better be able to understand, what we're talking about. For example, isotonic exercises are walking, swimming, jogging, bicycling. These are all, in all of these, your muscle contraction is happening, your muscle length is increasing, it enhances circulatory and respiratory function, it increases muscle mass, tone, and strength, it actually promotes osteoblastic activity that combats osteoporosis, right? Because of all the isotonic exercises. Isometric exercise, they increase muscle tension and work, but does not actively move the muscles, right? So these are beneficial for patients that cannot tolerate increased activity, for patients who are immobile. The benefits of this are increased muscle mass, because at least you're moving the muscle passively, right? And strength, and prevents muscle wasting. Remember, we talked about atrophy. And it increases circulation to the involved body part. So the body is, and also increases osteoblastic activity. So our patients that are immobile and cannot do the isotonic exercises, it's important for us to do passive range of motion so they can still get some benefits and keep their muscle tone and strength and mass, right? Resistive isometric exercises, when an individual contracts the muscle while pushing against a stationary object. So resisting the movement of the object. The benefits, it's like, you have resistance training, right? It promotes muscle strength, provides sufficient, stress against bone to promote osteoblastic activity. Now, it's the reason why, as we mentioned earlier, all this movement, isometric, tonic exercises, body alignment, center of gravity, all these things, these all help us to safely transfer and position patients. We need to use mechanical lifts and lift teams when patients are unable to assist. Please don't just, feel like you can lift up somebody who's 500 pounds and easily just do that because you need to get this done. No, because you're killing yourself in the process, right? When the patient is not able to assist, make sure you use mechanical lifts and lift teams, right? These are available in the hospital, right? When a patient is able to assist, you have to remember these principles. The wider the base of support, the greater stability of the nurse. The lower the center of gravity, the greater the stability. The equilibrium of an object is maintained as long as the line of gravity passes through its base. As we saw earlier over here, as long as this line is straight, your base, you're close to you have a white base and your center of gravity is about right here, and you're bending your knees, then this actually helps, this actually is considered safe positioning, right? You face the direction of the movement. It prevents abnormal twisting of the spine and stuff like that. So you're facing the direction of that movement. Divide the balanced activity between arms and legs. This actually helps to reduce the risk of back injury. Leverage, rolling, turning, or pivoting requires less work than lifting. So if you can do any of these, do these first before lifting, because that can also risk back injury. When friction is reduced between the object to be moved and the surface in which it is moved, less force is required to move it. So, reduce the friction and, of the object and the surface of which on which it's being moved. And we'll see examples. So let's talk about pathological conditions that affect body alignment. So remember we said, proper body alignment. We talked about what it looks like, what is normal, the posture, the alignment. Now, what are some pathological influences on this? For example, you have congenital defects. These affect the efficiency of the musculoskeletal system in regard to alignment, balance, and appearance. For example, you have these disorders right here, like scoliosis, right? Then you have bone, joint, and muscle disorders. These affect the integrity of your structures. So if your joints or bones or muscles, you have disorders there, right? For example, an example of that is osteoporosis. Then you have inflammatory joint disease, right? This over here is basically inflammation or destruction of the synovial membrane, the membrane between the joints, right? So examples of these are, for example, arthritis. Central nervous system disorders. This is basically damage to the central nervous system that regulates movement, because we said, remember, it's a combination of work. It's a teamwork between your musculoskeletal system and your central nervous system. So now if you have central nervous system disorders, what does it do? It regulates voluntary movement and causes impaired body alignment and immobility. For example, we have patients with traumatic head injuries. We call them TBI, traumatic brain injury, right? So what happens? It damages their movement. Spinal cord injuries, that also will, damage to spinal cord will result in loss of function below the level of the injury. So wherever your damage has occurred on your spinal cord, wherever the injury has occurred, everything below that area will, the sensation function will be lost. All right, then you have musculoskeletal trauma. This results in bruises, contusions, sprains, or fractures. So, for example, car accidents, things like that, right? Or somebody fell and they had a bone fracture, which is an example right here. It can be simple or complex disruption of the tissue continuity. Often creates the need for temporary immobility or of the affected part. So basically, sometimes they have to immobilize the fractured bone. So once again, let's talk about obesity, right? How it affects our musculoskeletal system and our nervous system, and how it affects our activity and mobility, right? Chronic health problem that negatively affects the musculoskeletal system. It can cause disability. It impairs our musculoskeletal health. Why? Because it puts increased burden on our joints and muscles. Now they have to hold even more weight and work harder. So it risk our low back pain, gait disturbances, soft tissue damage, osteoporosis, gout, fibromyalgia, connective tissue disorders like rheumatoid arthritis, high blood pressure, atherosclerosis, heart disease, diabetes, high cholesterol, cancers, and sleep disorders. Patients who are obese, they require adaptation in the approaches used to assist with walking, transfer, and positioning, right? Because, if they're obese, then there are different techniques that you have to use, and you have to be very careful to not hurt your back in the process. It's extremely important to use agency protocol for safe transfer standards. Well, that is it for your part 1 of your mobility, activity and mobility PowerPoint lecture. So let's go move on to part 2.